bienvenidos al foro sobre el impacto social del dolor. Ya por fin estamos aquí, soy María Madariaga, actualmente soy presidente en la Sociedad Española del Dolor y tengo el honor de abrir esta jornada impresionante que ha supuesto una enorme cantidad de trabajo, tanto para nuestros promotores, que han sido muy generosos con sus aportaciones, como para los miembros de la Sociedad Española del Dolor, que han sido responsables del proyecto. Tengo a mi lado a la doctora Padilla y, aunque no está aquí, también está el doctor Gustavo Fabregat, que han sido, bueno, pues un poco el alma mater del proyecto aquí en España, de esta edición. Bueno, vamos a hablar sobre dolor crónico, vamos a hablar sobre digitalización, vamos a hablar sobre dolor y cáncer, pero bueno, sí que me gustaría que Mariluz nos contaras un poco qué significa o qué impacto puede tener SIP, ¿no? ¿Qué es esto de SIP? El impacto social del dolor, ¿cómo lo dirías para un paciente o para un compañero, para un colega que nos esté viendo ahora? ¿De qué vamos a hablar?
Pues la verdad es que tengo que admitir que cuando se nos encomendó a Gustavo y a mí llevar a cabo esta plataforma a nivel España, no entendía lo que significaba SIP. Ahora ya me he familiarizado mucho con el concepto y SIP, no sé si lo sabéis, se formó a partir de un ente científico que es la EFIC, la Federación Europea para el Dolor, para el Estudio del Dolor, y una asociación de pacientes, PAE, que es Pain Alliance Europe. Conforme pasaron los años, se decidió que los países que tuvieran esa iniciativa y que lo quisieran, desarrollaran SIP o capítulos SIP en cada país. Y en España tenemos SIP España, que a nivel científico está liderado por la Sociedad Española del Dolor como capítulo de la EFIC. Entonces, me he dado cuenta, al estar en este proyecto, que no solo es importante el trabajo de los clínicos y lo que nos dicen los pacientes, que también tenemos que escucharlo más y por eso también esta plataforma, sino también el trabajo que se hace por gestores y políticos, porque sin ellos no se pueden llevar a cabo todas las ideas o todos los tratamientos o todo lo que queremos en pro del paciente. Entonces, es importante para la funcionalidad del paciente pues, que pueda tener un empleo adaptado a su situación de dolor crónico, que los pacientes con cáncer tengan esa parcela de su vida tan importante como es el dolor controlado. De ahí uno de los temas que va a ser muy interesante, del que nos hablará mañana Margarita de la Pisa, es el documento BECA, que es un documento que significa Beating Cancer, que es un plan del Parlamento Europeo en el que también se contempla cómo vamos a abordar este problema, y la digitalización y dolor, que gracias al COVID, algo bueno tendría que tener esta pandemia que hemos vivido, pues ha acelerado esa necesidad que teníamos de digitalizar la medicina, y es una forma de acercarnos más al paciente. La verdad es que es un proyecto que Gustavo y yo cada vez, conforme han ido pasando los meses, le hemos cogido más cariño y estamos súper ilusionados de que se celebre hoy este evento. El primer evento SIP España se llevó a cabo en el 2018 de forma presencial. Este es el segundo, que por las circunstancias que tenemos tiene que ser todavía online, pero esperemos que el próximo ya pueda ser también presencial.
Bueno, y como presidente de la Sociedad Española del Dolor, solo me queda bueno, pues daros las gracias por hacernos coanfitriones de esta jornada. Ya sabéis que somos una sociedad profesional multidisciplinar sin ánimo de lucro, que bueno, se fundó en junio del 90 con el objetivo de estudiar, tratar el dolor y promover bueno, pues un mejor abordaje. Esta plataforma para la SED bueno, pues es ideal, ¿no? Para nosotros, como capítulo español de la IASP y por supuesto de la FIC, pues es un honor y desde luego un placer poder compartir con todos vosotros estos 2 días apasionantes.
Y nada, sin más, vamos a pasar con Patrice, que como he visto en redes, nos presenta y nos representa en esta jornada. Es el presidente de SIP Europa. Es belga, pero vive en United Kingdom y compañero anestesiólogo. Así que vamos a ello.
Excellent. Thank you very much indeed for the invitation. Me disculpo por hacer la presentación en inglés. Me gustaría agradecer calurosamente a los organizadores y felicitarlos por organizar este evento. Thank you very much indeed. And I'm sorry because I will continue in English, but that's really great to see this kind of event and great attendance today. So I'll take next 15 minutes to present what the essence of Spain of SIP EU, and then explaining why SIP Spain has as any national platform, but specifically to you, how we see the integration of national platform in SIP Spain into SIP EU, and why is it absolutely essential, why there are then opportunities and potential benefit for engagement, and then how we can continue to interact and to enrich within a bidirectional dynamic, the different perspectives. So first of all, what is SIP? I will go relatively fast on that because you know very well what SIP is, but also re-explaining a bit SIP history and explaining a bit on the different actions and milestones, and telling you what are the plans and the benefits, as I've said. So you know that SIP is this partnership between professional organizations and professionals coming from the European Pain Federation, EFIC, and patient representative, and more specifically, in this case, Pain Alliance Europe. EFIC represents 37 national chapters and more than 20,000 healthcare professionals working in the field of pain. And the Pain Alliance Europe is an umbrella organization representing more than 800,000 people living with chronic pain. And so that's absolutely essential in the to integrate these stakeholders into a common forum, making it possible then to discuss what the problems are, and to go back to the authorities at a national level, but also at a European level, and more specifically to the European Commission, after having this kind of common discussion, consensus, and then really acting as stakeholders and able to make a difference. And we're guided by specific objectives, and after that I will speak about priorities, but specific objectives of SIP are raise awareness of the relevance of the impact of pain, and we know that the impact that pain has is massive at different levels of our societies. I will give some examples on health and on the economic system. What we can do is exchange best practices. So we can speak about problems, but we can also speak about best practices, and then discuss what are the solutions that have been identified in some countries and that may possibly be interesting to discuss in other countries as well, or at a European level. And then integrating that into a policy strategy or policy strategies and different activities is absolutely essential to improve pain management across Europe. So as you know, my name is Patrice Forget. I'm professor of pain medicine in the United Kingdom, but you've heard that I'm French-speaking. In fact, I've worked 10 years in Brussels and serving as the president of the Pain Society and SIP Belgium before SIP Europe. And I couldn't work without Deidre Ryan. Deidre is the president of Pain Alliance Europe and is our first patient representative. But we would be nobody without this fantastic team. And the SIP team, first of all, is managed by Jamie Wilkinson, which is SIP project manager. All of you working with SIP know Jamie is doing a fantastic work, and very well supported by Angela Cano Palomares, which is advocacy and project officer at HEFIC, and also working with Laura Thyssen, and obviously with Emilia Kozinska, who's working at Pain Alliance Europe, again in this model of co-lead. as I've said, SIP Europe wouldn't be that far without the massive investment of national platform, and SIPEspana is, of course, a very important, among others, but a very important partner, obviously, and so enriching the European perspective, and then we try to support as much as possible national platforms, and I will explain a bit how it's organized. Already a long history, I won't go into the detail, but a long history of SIP. Let's start from 2009, creation of SIP. And then in 2011, the SIP roadmap for action was written and published. And then there were different important events. If I can just point out, for instance, in 2020, cancer pain position paper. And then after that, in 2021, the publication of recommendations, and that was a bit the same kind of model used for participating into the healthy workplace campaign at the European level, and then we published in 2021 workplace policy recommendation. So that's a bit in very short, a long history of SIP, but we are guided by specific and well identified priorities, and these are listed here. So 4 clearly identified priorities. First of all, pain as a quality indicator, and that's very important to us to promote the existence or the integration of tools, making it possible to recognize better pain in different aspects or in the different healthcare system. And that's important, not just having pain on its own, but that's very important to promote the biopsychosocial model implementation in different systems, and by recognizing the fact that pain has different components, and pain can be severe because very intense, but also because there is a pain-related distress or pain-related disability. And the integration of these different aspects into tools that should be implemented in every kind, in every healthcare system, is an important definition of what we call pain as a quality indicator. That make it possible then to improve pain education, not only to recognize better what pain is, and to work with patient education and working on health literacy aspects, but also with professionals in educational programs, not only for pain specialists, but also for non-pain specialists in other disciplines. So that's clearly an important aspect that we want to promote. Pain in employment, I've explained that that's a priority, and that's a priority at different levels. And so going back to the employers, but also going back to the policymakers is important. And pain research, obviously, there are many knowledge gaps and need for better data to improve pain management. That's something that we would like to promote. And I will come with some specific examples again. So cancer pain policy and the position paper, I've spoken about that, and that has influenced already document produced by the European Commission. So that has an impact. So when you're going back to SIP Europe and when we discuss action points, that can have an impact after that, because we invite a member of the European Parliament, and then that can help them to be more conscious about what are the real problems that you are facing. So that's for cancer pain policy, but also employment, social integration of pain patient, also prevention of pain on the workplace, and pain in digital medicine. I will expand a bit on that because that's a priority for 2022, among other. But employment and social integration of pain patient is also clearly prioritized this year. Digital medicine, and that's directly linked. So that's an example that I wish to highlight. That's clearly linked with pain as quality indicator again, and the concrete implementation, or at least the discussion about the implementation of the new WHO classification of pain, the ICD-11, and that's an important aspect. And how to do that concretely? The further plans are, for instance, the 31st of March digital event. You're warmly invited to participate to that, but we have also stakeholder forum later, national platforms calls, and these kind of events can then render very concrete involvement of national platforms, but also the life of SIP Europe. Examples of timelines, again, I won't be into all the details of SIP activities, but you see a typical annual agenda of launching a position paper, organizing workshop, calling people, going back to national platforms, and doing regularly quarterly calls and developing the priorities for the year after. So you see a little bit how a typical year works. So what we've done is preparing the digital position paper, and then we will launch that and organize different activities after that to go to the European Commission and then to discuss proposal, in this case, in the second quarter of the year, the proposal on a European health data space, but these different tools progressively make it possible to build a strategy, and then after that to go for translation and dissemination of positions papers. And that's the case for the different priorities that we have. And so for the ICD-11 that I've mentioned as well, so the new pain classification of the WHO, also we discuss about that, we revise the position paper that are discussed, we implement that, and we organize events to promote the important aspects that have been identified at a European level, at the condition that it makes sense at a national level as well. And we don't forget the previous priorities, so employment, and that's a very important aspect, obviously, and linked with other projects like the cancer pain policy, because on a workplace, typically pain and cancer can have an impact. And so we do a regular follow-up of what has been done, how the different works can be linked, and what is the impact, the real impact of the activities that we organized together, and that can be translated in concrete results. So you see how rich it is. Again, I won't go into the detail, but I think that it was important to you to understand how it's organized, how it's structured, and how the sequence works and is followed later. Be directional. That's very important. Be directional. That's also an opportunity for you, I think, and not only at a European level, but that's also an opportunity for you, I think, to gain experience, to exchange experiences about different practices. I've mentioned best practices. That can be also issues, and issues can typically be documented when sharing data or just sharing surveys, and then participating to surveys is a very important aspect of something that we can do together, because the power of that at a European level make it possible not only to recognize what happened nationally, but also what are the commonly identified issues at a European level. The visibility of that at the EU level then is possible not only for SIP Europe, but also for the participants of SIP national platforms. And so that's a good experience. And we had a very good feedback of people working from national platforms to SIP Europe, and then to participate to different activities. And obviously that the social media and our website can offer support for the national platforms and for the campaigns that you may organize nationally. That's like how national platforms calls look like. And so we have typically a big place for discussions and interactions. And then there are many activities that are organized on top of that, and then making it possible to interact and to gain experience. Typically, yeah, one example, the first one of the slide is participating at an in EU level policy advocacy activities, and then influencing activities related to pain. That's just an example, and you see that many different aspects of what patient advocacy activities look like. There is always a possibility, so don't hesitate if you're interested in participating into that, and then going back to the stakeholder forum and the network, and then to have the possibility to expand a bit the vision. So that's something that we organize. We can also offer support, I've mentioned that before, to national platforms, and then making possible to together participate in centrally coordinated communication campaigns, but also to boost social media participation and visibility of national platforms activities, and vice versa, this bidirectional kind of way to work, make it possible to have or to reach a great degree of visibility. And closing the loop, it's also possible to participate to communication into scientific journals, and that's important to inform the scientific community or the professionals more in general, not only scientists, but also the clinicians, of what patient advocacy activity is about, and what working on pain policies is about, and then informing the scientists and the clinicians on what is done and how science may influence policies as well. Please don't hesitate. That's my last slide, but not the less important. Please don't hesitate to get back to us. We have a website, but we have also a generic email address, and obviously a fantastic project manager, Jamie. Please don't hesitate. We're more than happy to discuss that with you, to participate, and to support SIP Spain as much as possible. Thank you again.